diabetes, high blood pressure, obesity, heart attack, stroke, amputation, prostate cancer. A healthcare crisis out of control.
And making a difference, a place where getting a haircut is the healthiest choice you can make.
Well, at some African-American-owned barbershops, clients are now getting a cut and a checkup.
You've launched this organization where you go into black barbershops across the country to test for diabetes.
African-American men are dying prematurely from preventable diseases affecting the viability of our families and communities across this nation. That's why the Black Barbershop Health Outreach Program is committed to bringing health care to barbershops across the country with a three-pronged approach. We screen, educate, and refer. We screen men for diabetes and hypertension. We educate men about healthy lifestyle choices as well as prostate cancer decision-making. We refer men to local healthcare resources for follow-up care. Many men have been sent directly to the emergency room from the barbershop as a result of life-threatening test results. And to our surprise, some men have never been to the doctor in their adult lives.
Never? Seriously?
Seriously.
You've never been to a doctor?
I mean, you know, when I get hurt and stuff, yes, yeah, but other than that, no.
Black-owned barbershops have played many roles in the African-American community as nerve centers for voter registration campaigns, as places where men discuss politics, sports, relationships, and now we're talking about our health and how to make healthy lifestyle choices. Over the past 2.5 years, we've screened over 10,000 men in cities like Los Angeles, Chicago, Manhattan, Atlanta, St. Louis, Kansas City, and New Orleans. And this year, with the help of our volunteers and partnering organizations, the Black Barbershop Health Outreach Program is on a mission to screen and educate over 20,000 men in 50 cities and 750 black-owned barbershops. Help the Black Barbershop Health Outreach Program save lives by screening, educating, and referring men to the proper health care resource.
I grew up in Detroit. My father, an internist who worked on the east side of Detroit in underserved areas and often treated uninsured patients. And so I grew up with a real sense of commitment to trying to figure out a way to reach vulnerable populations. He did it one patient at a time every day. I sort of wanted to go about how do you figure out how to do it for whole communities. I say all that to say, before I get into the talk specifically about the Black Barbershop Health Outreach Program, because he used to always tell me you sort of don't really, care how much you know until you know how much someone cares. And it's really through his work that I've developed such a deep commitment to trying to work to eliminate many of the health disparities that exist in the African American community and in all communities, frankly. Those disparities I spoke of specifically are that black men often are diagnosed at 1.6 times the rate as others. They die at twice the rate. They often have more aggressive prostate cancer tumors than others and are diagnosed at younger ages. And as many of you know, the tools that we have to diagnose and screen for prostate cancer are imperfect. We know that, but we have to continue using it because men die every day from this disease. The mortality benefit has been questioned in terms of, you hear the numbers about treating 48 men to save one life. However, studies in Europe often demonstrate now that you can reduce mortality by screening men for prostate cancer by 50%. So there's conflicting recommendations, and for African American men in the community, that is particularly dangerous because that confusion leads to inactivity. They're paralyzed as a result of having misinformation and information that's incomplete. So what we wanted to do was make sure that men in the community are informed about prostate cancer, understand the disease, and then understand how they can fight that disease if in fact they have it. And so we sought out to try to prove, what is the most effective strategy? How do we reach men in this way? And so what developed was this program, a program that started simply by a conversation between a doctor and his barber. Nothing more complicated than that. Not needs assessments, not trying to figure out, what is the most effective way to reach this population. Just a simple conversation through an observation that black men tend to hang out in the barbershop. It's our country club. Norm Nixon is one of our spokesperson. He's a former LA Laker. And he used to always say, that's where you hang out. That's where we talk. You may go to the barbershop, spend 6 hours there, and not get a haircut. And so what we developed was an outreach health promotion program in the barbershop where we go and educate, screen, and refer men. That referral process, we wanted to formalize. And so we actually use trained community health workers to then navigate men into the healthcare system, not through it, but to get them in, because frankly, they weren't getting in. We have men who would tell us, my parents never took me to the doctor. I haven't seen a doctor in 40 years. So how do I even get to make an appointment? When I go to a free clinic, I have to sit in a lobby for 4 hours and maybe see a doctor at some point. So how do we ensure that these men have doctors who will see them, who will treat them with respect, and people who they will want to go back to see again? And so we are able to try to connect men with the clinics that are in the area, transport them to clinics that they need to get to, and figure out a way to make them aware, or make the public aware, policymakers aware, that there's a desperate need in this community. And we do this in other communities as we go into them around the country. We looked at it, developed a conceptual model for why we think this works. We mapped all the barbershops in our network using GIS technology. We leveraged new partnerships with the Prostate Cancer Foundation to obtain more funding. We created an automated database that's actually run by Salesforce.com, a large company that typically does database management for retail organizations. They do it for us for free. So we're able to track men around the country and have information on over 4,000 men around the country who we screen. We've created a publication plan to get the word out about this, and we've diversified our funding strategy so we can keep this thing sustainable. We have to leverage communities. We have to leverage volunteer networks. We have to raise awareness, and then we have to evaluate the programs that we do and use all that to actually reduce health disparities in real time and not just acknowledge the problem. We need to actually solve it.